The next part would be extraarticular, meaning outside of the joint. And a lot of these areas that people will have pain is primarily on the outside of the hips. Sometimes in the back here, sometimes in the front, but primarily on the outside. First part we'll talk about is the hamstrings. So just below your butt, right down in this area where you can kind of flex and bend your knee towards you, you have hamstring tendons and muscles. Tearing can be very common just because as we get older and as we do less sports and as we're less pliable, and we tend to have tightening of these muscles. It's not something most people routinely stretch. So any small slip or something like that can cause you to have a rip, a tear, or pull in that area of your muscle. When it's right in the middle of the muscle itself, there's not a whole lot to do but let it heal. What happens is you get a blood clot in that area, that blood turns into scar, and that scar eventually incorporates into the muscle tissue itself. On bigger tears, bigger rips, bigger pulls, where it goes all the way down to your tendons, those are ones that might benefit from having a surgical repair, just because the tissue there is more robust and it's more amenable to having a repair. Pain will typically be down in the area when you use that muscle, and it's right down the thigh itself. Typically, it doesn't go past the knee and stays right in that vicinity. Similarly, on the opposite side of the thigh, kind of in the front where you're sitting and you're pushing on your thighs, you can have any tears or rips or strains or pulls on those tissues in the front of your leg. Your quadriceps muscles, which are the main bulk of the group of the muscles in that area, are the ones in front. And similarly, during physical activity or slips or tears, you can get the same type of tears in the tendon, which usually just heal by themselves. Similarly, the adductors, or the muscles of the hip that bring your hip downward, they do all exactly the same thing. Most of these tears, rips, strains, or sprains, they take about 3 months to resolve, and most of them resolve by themselves. Persistent ones with defects or weakness can be because of tendon tears and may be amenable to surgery. By far, the most common pain that people have that's kind of around the joint but not necessarily in it is what we call this greater trochanteric pain syndrome. Sometimes it's been referred to as bursitis or inflammation on the side of the hip. It happens most commonly at that jutting out where you feel the bone on the side of your hip, particularly when you pull across or stretch that area or even just pushing on it. It's more common in women, like most hip issues. It's more common when you've gone through periods where you haven't been too active and maybe increase your activity level. Sometimes it can result from tears, but that's the minority. Your IT band or your iliotibial band is a big thick piece of tissue that helps support your knee, leg, and hip. It starts up at your ilium, which is kind of the crest of your bone up here at top, and then it goes across that prominence that you can feel on your side of your hip. We have a little pillow sac of tissue that goes between the end of the bone and that thick banded tissue to help protect it. It's called a bursa, and a lot of times that bursa can get irritated or inflamed. And just that tight tissue rubbing on that small area can cause that fluid to fill up, cause you to have inflammation and generate pain. The two areas that you can feel it the most are up at the hip level, and sometimes it goes all the way down to the knee level. People typically say it hurts right here. They'll point to that area, and that's usually exactly where they're showing it. You can see on this person was having pain. If you look at the MRI, and I know it's kind of a funny shot, but this is the pelvis itself. These are the hip joints here. And then this side area is a fluid collection that's on the outside of the side of the hip on the bone there. Same right here is what we're looking at, is a fluid collection right there on the MRI. That's what we're looking at over here, and that's indicative of inflammation on the side of the hip. Again, with the light there, it might be a little bit tricky, but tendons on an MRI should look nice and black and thick like a big triangle here at their insertion. Over here on this area, which is a flipped image, all this fluid is kind of invaded into that area, and the only way that fluid can get in there is if there is a separation between those tissues, a tear. And that's how we tell that something's torn in there. There's cool procedures you can use to fix those that we'll talk about in just a second, but primarily it's the same sort of things, trying to fix it again, with the addition of something called the EWST, or the shockwave therapy, where you can try to use sound waves to stimulate healing. Just like if you have problem healing a bone, you can use a bone stimulator. They do the similar sort of thing by stimulating those tissues to grow and to knit together. One of the cool surgeries that they do is a IT band lengthening, where you basically take some leaflets of your IT band and you can actually flip them over, giving you more space on the outside to decrease the amount of tightness on the side of your hip. You can also, in evidence, when you have tears, You can actually put a scope in there and repair the tears down with sutures right through the skin itself. The third part of the back pain, sort of trifecta, is low back pain. Very, very common. A lot of times is confused for hip pain, generally generated by arthritis in the back. There are different arenas of back pain, hip pain, butt pain, but most people feel it comes kind of deep down when they're talking about their hip, and sometimes it's a place they can poke or push with a little bit going up or down, even sometimes shooting below the knee. Muscle strain is pretty common. Degenerative disc disease is pretty common. Arthritis in the back is pretty common. The risk factors are a lot of the same risk factors for most issues and diseases. It's obesity, smoking, wear and tear over time, hard jobs, labor jobs. The red flags and the things that we really worry about the most are, number one, we don't want it to be an infection. Number two, we don't want it to be a tumor. Number three, if you have a trauma. But the red flags tend to be either jolting pain that shoots down the leg into a specific toe associated with the hip pain, any loss of bowel or bladder control, or any time you lack the sensation around the butt region. Those are all red flags for your nerves being pinched pretty badly. Musculogenic back pain is the most common. And you can have just a pull in any of the muscles or your gluteus, just like you could have any pulls or your quads or your hamstrings that are going to cause you pain that shoots down in the back. Back pain is usually accompanied by spasm, and it can go into the side of your hip and leg and cause that symptom that it's coming from deep down around this hip region. Discogenic back pain is kind of an older term. We tend to talk about a disc having pain just by itself. We're not really sure that it happens anymore. Usually it's the fact that the disc itself is pushing on something like a nerve and inflaming it. If you took those views just through this line like you're right here, and you're looking at that pooched out place, you can see how it would push on the back of the nerve and cause inflammation. We used to think that just being weak in the disc itself could cause pain, but more likely it's the fact that it's pushing on something causing that inflammation in the back. If the disc pushes hard enough on a nerve over time, it can cause it to degrade, it can lose that signal, and you can get weakness. The primary symptom, however, is it starts out with pain. Dermatomal is just a term that means that it goes down a specific area. Throughout the years, we've mapped where specific nerves go and what skin and sensation they attack, if you will, if they get blocked, and they usually go to certain areas of the foot. That's what a nerve will do if you get pinched in your back. There's lots of different terms for the different areas of the back that can be affected. In general, the term is spondylosis, which means arthritis of the back, but it can be in the facets in the very back, it can be between the disc levels itself, and it can be spurs that go over in front. In a normal spine, you should be able to see, even on an x-ray, that good amount of space between the end of the vertebral bodies. When we're looking at an arthritic spine, you'll start to see a confluence or flowing out of those spines and spurs at the end of the bone itself. That means that the space between the bones decreases. Also in the back where those joints are, you can see that if they become more arthritic, they start to pinch on nerves in your back as well. People usually have an event when it's a slip disc or a big herniation, lifting something heavy, twisting a funny direction, and then it usually shoots down one leg. By and large, the most common reason we have pain in the back as we age is arthritis. And you can develop this condition called stenosis. Stenosis just means tightening or narrowing. You'll find that people will have their discs can be bulged, the facet joints or the joints in the back can be thick and arthritic, the ligamentums or the stuff that puts all the bones together can be thicker, and that can cause you to have decreased space for the nerves, which chronically are being pinched over time, causing pain that tends to settle right around the butt. Treatment for most orthopedic things, like always. There's lots and lots and lots of different things that can cause hip pain. By and large, the most common reason we have pain in our hips with age in the joint is arthritis. Hands down, that's the number one reason. The most common pain caused by muscle, tendon, or tissue area issues is going to be that greater trochanteric pain syndrome, or that tight tissue on the side of your hip. And lastly, pain that feels more kind of in the back or the buttock region, sometimes even shoots down the back of the knee or leg, is usually arthritis in the back or spinal stenosis.